Welcome back, Mama Dr. Jones, ObGyn, and Mom 24. You're never going to guess what happened today. I found our carrot friend. I know. I just bent down to get something off the floor and it was under the chair over there. Clearly I looked super hard for it when it was missing the first time. Today, we're just going to enjoy having Mr. Carrot back for a little happy carrot video where we react to the Try Guys delivering a baby.
Doing this for the very unlikely but very real possibility that Ned finds himself in the middle of the woods when Ariel goes into labor and he has to deliver the baby himself.
So it sounds like Ned's wife is or was pregnant at the time that this video is done, which makes it extra hilarious.
What do I know about the actual delivering of a baby?
The whole process seems crazy. You're like a human printer.
I've never seen any sort of human birth.
That little model that they have there is a pelvic model that I actually very similar to that used to learn how to deliver babies as a medical student. Super cool. They're using real life medical training equipment.
So, welcome back, yes.
You just welcome her back into her own office?
Yeah,
Welcome back.
Oh my God. The Try Guys are meeting with an ObGyn doctor on a regular basis. I need in on this. Dr. Yvonne Bond, I'm coming for your job. I am coming for your job.
We're going to deliver a baby.
Okay, sounds fun.
Using a medical model.
Okay.
Is it fun?
Is that fun?
I would say the outcome is fun.
Sure.
The end result is fun. The process is not that fun.
I like the process. I mean, it can be scary. I understand what she's saying, but I enjoy it.
I think I'm the only one here who's never seen a birthing video. I have seen inside myself multiple times. I've seen inside other people multiple times. I don't think this is gonna be that crazy.
We're gonna be using the actual dummies that medical students use to practice delivering baby.
The way I look right now is how I think my parents have always dreamed, and yet I failed them, and now I'm making a video where I pretend like I actually have this job. Are you a child doctor? Is that how they say it?
Pediatrician?
Pediatrician, yeah.
You don't deliver babies, but you've done it.
Correct.
So you are totally down to teach us how to catch a baby with this tool that you've never used either.
Correct.
Great.
They're learning how to deliver a baby from a pediatrician, which is fine. Pediatricians go to medical school. We all do some of this in medical school. But hey, Try Guys, if you need an ObGyn, I will come to you wherever you are. Let's learn how to do a C-section. Call me, Try Guys. I'm super funny. We're the same. I'm not very funny. Call me. Let's learn a C-section together. Pick me.
So this is our high fidelity birth simulator.
Her name's Fidelity?
High fidelity.
I love his corny jokes. It's killing me. But what is on his head? I think it's supposed to be a scrub cap. It's either not a scrub cap or it's on backwards, and it's cracking me up.
Want to do the honors?
Yes, I sure do.
Okay, that's good. That's good. We're good. In real life, you got amniotic fluid.
So on these medical models that we use, you have to put a special lubricant on them. The silicone has a lot of friction, so if you want them to work well and to hold up well, they have to be lubricated so that when the baby comes through, it makes it much more lifelike. He said in a real delivery, you have amniotic fluid, and that's true. That provides some lubrication to the vaginal canal as baby comes out, but we also use mineral oil. I'm gonna go grab a baby because I have a feeling at some point in the process of the next 10 minutes of this video, I'm going to need to show you something. One moment. This video is sponsored by Drop. Drop is a super cool app which you put on your phone, link your credit card to, and accumulate points anytime you use your card, either through the shop page at normal shops where you are already gonna do shopping, or you use that card in a brick and mortar store that is linked to their app. You accumulate points and you trade them in for gift cards to like Starbucks. The best part, they're giving 100 of you a gift card from $5 to $25 just for downloading the app and linking your card using my link. So download it, link it, see if you like it, and if you do, get free things. If that sounds great to you, download the Drop app using my link in the description or use code MDJ. Thank you to Drop for sponsoring this video, and thank you guys for supporting me endlessly. Let's watch the Try Guys deliver a baby. I couldn't find a baby, so we're going to substitute Iggy the iguana. Use your imagination. This is a newborn baby. Thank you.
The majority of babies are supposed to navigate themselves down.
The uterus is like this big room full of muscle.
Do they call it the uterus because the baby goes from uterus?
Love it.
So I need to check to see if the woman's dilated.
You gotta make sure. And we're looking for 10 centimeters. That's the magic number. The cervix. You feel it?
Oh yeah, oh wow.
There's the baby's head.
Baby's right here. Oh,
And you
it's right
can-
here. It's happening.
Wait, you actually feel the baby's head when you do that?
Yeah.
So this is how it typically comes out, right? Head first?
Cervical dilation is based in centimeters from 0 to 10. A cervix is like a, like this, open on this end too. That's kind of what a cervix would be. And it's not the vagina. You're not feeling of the vagina. The cervix is the end of a uterus. So the cervix is attached to the uterus and the baby is here. And as the cervix dilates, this distance gets bigger. So when you feel to do a cervical exam, what you're doing is feeling to the cervix, and then you identify the round circle of the cervix and you test the distance like this. This cervix would be like 4 centimeters dilated, and we're looking for 10, which is like this. And then effacement or thinning is the length. Average is 0%, which would be like 4 centimeters, and that goes up to 100%, which is completely thinned out. This distance shrinks and this distance gets bigger.
So sometimes if the baby's head's facing straight up, labor doesn't go as easily and it can be a little harder to get the baby out.
Not as easily.
So it can just take a lot longer or might need to go for a C-section.
What he's talking about is OP presentation or sunny side up or stargazing. Normally we expect when we get close to being ready to push that the baby is facing down with relation to how mom is sitting, so towards mom's back, and that just allows the baby to come out more easily. If baby is facing this way, we call it occiput posterior because the back of the baby's head is facing the back of mom. A lot of babies are occiput posterior in the early parts of labor. Once you get to about 5 or 6 centimeters, you're thinking baby's at least starting to turn or completely turn to be occiput anterior, but some of that depends on the shape of mom's pelvis. If we're going this way, the head can go this way and kind of tuck and come out. But this way, if the head tucks, the distance here is wider. Lots of babies are born sunny side up vaginally. It's just way harder.
So once the baby starts to crown, you're gonna see the baby kind of rotating, and eventually the head's gonna come out. And so the head's gonna turn to the right or to the left.
What do you mean help him? There's nothing to do. What do I pet it?
Shoulders, which is actually what's happening right now, can kind of get stuck on the pelvis.
What?
And then you're gonna see the little head of the baby.
I like to do what I call a tripod on the baby's head, which is just to place my hand kind of like this and not put pressure back. I don't want to counteract the work that the patient is doing. I have my hands here to gently guide the baby in case of sudden change in position so the baby doesn't fall, and so that if there's vomiting or something, the baby doesn't cause a bad tear by having an uncontrolled push. You never want to counteract what maternal effort is doing to get the baby out, but you do want to provide some support in that process. So this would be like this much of the head is showing at this point.
All right, there we go. All right, so I'm gonna.
Oh yes.
Oh, there we go. All right.
guys.
So this is the important part, though. We have to get the shoulders out.
Well, the shoulders are the hardest part, right? Even in real birth.
I mean, just think about this is the widest part of your body, right?
Wow, look at it. So it's just
You ready?
hanging there.
And
The shoulders usually are not the most difficult part. The head should be the most difficult part. What they're about to describe, I think, is when the shoulders are the most difficult part, which would be called a shoulder dystocia. In a normal delivery, the head should take the longest and the shoulders should quickly follow.
Almost like a sandwich. You're gonna put one hand here, one hand here. All right. And you're gonna pull down on the head a little bit to get that shoulder out. There you go.
What if I rip the head off?
It's okay.
It's okay to rip the head off?
She's like screaming now, right? Like,
I then slide my hand to the back. I kind of feel for what we have here to see if there's a umbilical cord or anything wrapped around the baby's neck. I would gently place my hands in the direction of the baby's face. So we called this in medical school fingers to face. You don't want to do it like this. Like I don't want my hands crossed. This is awkward. You don't want to put traction on the shoulder. You just want to see if the shoulder comes through. And this shoulder is what we're talking about here, coming underneath the pubic bone.
Oh, the shoulder is kind of separating from the joint.
what if the shoulders don't come out?
Oh, we're at risk for the baby losing oxygen, so we need to get that shoulder out.
If you do that and this happens and the shoulder comes down a little bit or not at all, and it doesn't come out, that's called a shoulder dystocia. And then you have to go through the process of relieving that. It's an emergency, and it's something that should be handled swiftly and by someone who's knowledgeable in the process of safely fixing the problem.
When the head is getting compressed by the vagina and the perineum, sometimes the baby will start to have decelerations in the heart rate. So the baby's being monitored during this time. And so the baby can't sit there for 10 hours. I mean, it's usually a matter of minutes before, once you're at that point, the baby actually is out.
So nerve injuries are the most common poor outcome of a shoulder dystocia. Brachial plexus, which is a huge nerve bed under the clavicle. You worry about lifelong inability to use the arm, things like hypoxia and brain damage, and even death if you can't get the baby out. So this is a serious emergency. It usually doesn't happen. If it does, we can usually resolve it in less than 3 minutes, but it can be really life-threatening and scary.
You're gonna have to catch the baby.
I have to catch a baby? Well, it doesn't shoot out.
It can.
You kind of guide it, and it's like a little maneuver. You just kind of flip it around like a football. It's...
This baby's, oh, there we go.
No, that was a little too hard, sorry.
Widest part of the baby is out. There you go. Look at that.
Whoa!
You got it. See, look. There you go. Perfect.
Ariel and Mike, we're a family.
Look how happy he is.
Oh, yeah.
They're cracking me up. If the shoulders come easily, which usually they do, then after I guide the head out and the shoulder is out, I will switch my hand from being on top of baby's head with the fingers to face position to slide down and hold on to the neck here. And that gives me support to make sure the baby goes exactly where I want it when the rest of the body comes out. The other hand I have here is just kind of guiding baby. I'm gonna guide, and then once all of Iggy the iguana has delivered, I'm going to flip around one leg on either side of my arm here, and I'm going to encourage some crying and breathing.
Now we bring the baby out and we put the baby directly on mom's tummy.
There you go. Skin, we call this skin to skin. I'll prop her up a little bit. So.
Oh, I'm so proud of you, sweetie. That was amazing.
Baby is still attached by the umbilical cord to mom, and usually within a matter of seconds after the baby has been delivered, I can go ahead and just put it up on the chest for skin to skin.
Don't we do one of the...
Yeah, we want baby to start breathing, to cry. Nowadays we just go for a gentler, nice hold and maybe rub the baby.
Hey, are you good? Are you good in there, baby?
But you're in the woods, right?
Yeah.
And there's still the afterbirth.
Is this really what it looks like, Travis? Oh, yeah, there you go.
You did it. Just got like sprayed.
So if Ned doesn't deliver his own baby, I give you permission to go on his Instagram and call him a little bitch.
Thank you guys so much for watching. If you're ever in a labor situation, you can use these steps, and make sure to post a comment as to how it went when you delivered your own baby.
Maybe not so much.
Oh man, that was really good. I hope you guys learned something today about how a baby is delivered, and I hope that you don't ever have to use that in the woods. But if you do, give all the credit to the Try Guys and not to me. I hope you learned something. If you like this video, which I know you did because you're still here, give it a thumbs up. Iggy the iguana will be very appreciative. Hit subscribe, turn on those notifications. Be kind to yourself, to each other, to me, and the comments be kind. And I will see you next time.